My name is Amanda. I'm an occupational therapist and yoga teacher here at Jade Integrated Health. Postpartum home visits are an opportunity for a therapist to come in your home, and it'd be myself or one of our other trained therapists. It'd be one of those early weeks of postpartum, so right after childbirth, within that first week to 6 weeks before your postnatal visit. And we'd come into the home and we'd look at things like diastasis, so we'd check the abdominals, we'd discuss things that might have come up from the birth. We would talk about safe return to exercise, any kind of issues that might be surfacing with bladder or bowel dysfunction, and anything else that maybe a person is kind of dealing with in that postpartum period. I would introduce myself, you would show me kind of your positioning for where you're feeding baby. We talk a bit about the ergonomics for that setup to make sure you're best supported. I'd ask you a bit about your birth, the birthing process, how that went, any kind of symptoms that might be surfacing, bladder, bowel, pelvic-wise, any pain that's coming up. I'd be looking at your diastasis, so doing that check. Other things that I might do in the home would be a general kind of posture assessment, looking at some muscle strength testing, and then we might move into a discussion about safe return to exercise, where we then would go over some general, very gentle movements to help reintegrate the abdomen, core, things like that, and for that foundation for returning to exercise. Postpartum home visits are super important because they are an opportunity to fill the gap essentially between your birthing and then your 6-week postpartum visit with your provider. It gives us an opportunity for women to bring up any issues that might be coming up, or to integrate the new role of mother and kind of having support there. It's really important because if there is stuff coming up, we're a liaison between you and your provider, and so we can address things like that. We can reach out to your provider. It's also really important because women have a lot of questions that go unanswered, and we feel that for that length of time is too long, so we want to get in and help with new moms. So if you want to schedule an appointment with Jade or one of our therapists for a postpartum home visit, I would call the front desk, and then they can chat with you about insurance questions, whether you need to get a referral from there, but start with calling the front desk.